You know that feeling when the words you want to say just won't come out? Today, we're diving deep into the science behind stuttering. We're going to break down what's actually happening in the brain, take a look at the real paths to treatment, and follow one child's incredible journey to finding his voice. Let's dive in.
These were the very first words spoken by a 6-year-old boy named Arya during his initial therapy session. Just in that one sentence, you can feel it, can't you? The struggle, the sheer effort, and that deep desire just to communicate. It's this feeling of being trapped by your own words.
So what is actually going on inside the brain and the body during a moment like that? To really wrap our heads around this feeling of being stuck, we have to look at the science behind it all.
All right, Section 1. What is stuttering? We're going to unpack this whole idea of a jammed motor and see what's really going on under the hood. Okay, so at its core, stuttering is a psychomotor speech disorder. Now, a really great way to think about it is this. The brain has a kind of motor for planning and then executing speech. For someone who stutters, that motor can get jammed up. The person knows exactly what they want to say. The words are right there. But the mechanism to get them out just isn't cooperating. Now, the signs of stuttering go so much deeper than what we actually hear. Yeah, of course, there are the repetitions and the blocks, but there's also this whole hidden dimension. The physical strain, avoiding certain words, and that simple, powerful fear of speaking. This can lead to something called covert stuttering, where the outward signs might seem small, but the internal struggle to manage every single word is just immense.
It's also really important to know that not all stuttering is the same. I mean, look at this. The vast majority of cases, we're talking a whopping 90%, are developmental. That just means they start in early childhood. Only a tiny fraction is acquired later in life.
So the key difference really boils down to two things: timing and cause. Developmental stuttering, which is by far the most common, usually pops up between ages 2 and 5, right when a kid's language skills are just exploding. Acquired stuttering, on the other hand, is totally different. It's triggered by a specific event later in life, like a brain injury or some kind of psychological trauma. So the million-dollar question, what causes it? Well, the truth is, there's no single trigger. It's a really complex mix. You've got biological factors like genetics, it definitely runs in families, and even subtle differences in how the brain is wired for speech. Then, you layer on top of that some external factors like performance anxiety and even environmental pressures. It's the combination of all these things that can create the conditions for a stutter to emerge. And this leads us to what might be the single most important takeaway in this entire explainer. It is never the child's fault. This isn't a choice, and it's definitely not about a lack of effort. Understanding this is the absolute first step for any parent, family member, or friend who wants to help. Okay, so what can be done about it? This brings us to Section 2, the roadmap to treatment. Let's look at how speech therapy actually creates a clear path toward more fluent and, just as important, more confident communication. Therapists have a whole toolkit of really effective evidence-based approaches. For the little kids, there's something called the LIDCOM program, which is amazing because it empowers parents to help right at home. For teens and adults, you've got the Camperdown program, which focuses on controlling things like speech rate. These methods often fall into two main philosophies. One is fluency shaping, basically building new fluent patterns from the ground up, and the other is stuttering modification, which is all about making the stutter itself easier and less tense when it happens. But a therapist's job is so much more than just teaching techniques. They're also working to dismantle all the fear and anxiety that builds up around speaking. And they address family dynamics, too. This is huge. Sometimes, a child isn't afraid of their own stutter. They're afraid of their family's reaction to it. A great therapist supports the whole person, not just the speech.
All right, Section 3, Arya's therapy journey. To really see how these ideas work in the real world, let's circle back to Arya and see how this structured approach made a real, life-changing difference for him.
So when Arya first came to therapy, this was his profile. He was 6 and his stuttering had started 2 years earlier. His symptoms included some pretty severe blocks, visible tension like pressing his lips together, and he was already starting to avoid words he was afraid of. Now, here's a key detail. His family, who were just trying to help, were frequently correcting him, which was accidentally adding even more pressure. His stuttering was rated as moderate to severe. So here was the 3-month plan, and I want you to notice the very first step. For 2 full weeks, the focus was just on his parents. on reducing pressure at home. It was only after building that safe foundation that they started to introduce simple techniques through games. From there, it was all about taking those new skills into real conversations and finally taking them out into the real world, facing those fears head-on.
And that brings us to our final section, hope and action. So what happened after those 3 months? Let's look at the results and pull out the key takeaways from Arya's amazing journey.
The transformation was honestly remarkable. After just 3 months, Arya's stuttering severity dropped from moderate to severe all the way down to mild. But you know what? More importantly, the experience of speaking completely shifted for him. That fear was replaced with a new confidence. He wasn't afraid to tell people what happened anymore.
So what are the big lessons here? First, stuttering is absolutely treatable. Second, the family's role is not just important, it's vital. It really is a team effort. Third, getting help early is crucial for the best possible outcome. And finally, the right approach, when you combine it with just a little patience, really does work.
And this leaves us with a final question to think about for ourselves. The absolute core lesson from Arya's therapy was reducing pressure. So think about your own life, your own interactions. Whether it's with a child who's learning to talk, a coworker getting ready for a big presentation, or a friend who happens to stutter, how can we all work to reduce that speech pressure and just create more space for people to speak?